It's my pleasure to introduce someone that I met last year who was a patient with advanced melanoma who went on to a clinical trial in Los Angeles, and now she's here today to share her story with us. By way of introduction of Janie Ferling, I'd like to begin with showing you a very short video. Thank you.
I'm originally from Los Angeles, born and raised here. I enjoy a lot of outdoor activities, visiting my son who lives away at college now. I have a business, and I enjoy getting together with friends. And I have stage 4 metastatic melanoma. When I was first diagnosed, it had already metastasized into my lymph node in my neck. I had a radical neck dissection, and 72 lymph nodes were removed. When I was first diagnosed and we were discussing what type of systemic treatments to do, the doctors were telling me that it would not change my life expectancy, but that it might prolong the amount of time for a reoccurrence when a tumor would come back. And I said, wait a minute, what are you talking about, life expectancy? What's my life expectancy? And I was told that 50% of the people would die from this within 5 years. I tried everything I could not to be in that 50%. After I did interferon for 10 months, it turned out it didn't work. A year later, when it came back as a brain tumor, then it became stage 4. When I was first diagnosed, the first thing that came to my mind was I want to make memories with my son. I wanted to go on vacation, and I really couldn't. I was too sick. I knew that I wanted to do something with a clinical trial because the regular drugs that were out there were very toxic and not effective.
Janie came to us when we were starting this phase 1 trial of combining T-Vec with pembrolizumab. And she had these big masses in the neck that were really obvious. And we thought that it would benefit from the start to have a combined therapy.
One of the drugs I get is Keytruda. That's the one that is given in the infusion center. What the Keytruda drug does is that it releases the brakes. And so it will allow my T cells to do what it's supposed to do. At the same time, I'm getting the other drug, which is T-Vec, which is a deactivated herpes virus. So by injecting the virus directly into the tumor, my immune system is awakened and it knows exactly where to go. So the combination of the two is what's been working for me. One day I went in and there was nothing large enough to inject.
To have to stop injecting because we don't see melanoma, it's a good thing.
We were all happy. We were all very, very happy. I still go in for the infusions every other week and will continue to do that. The T-Vec had side effects: fever, joint pain, neuropathy in my feet, fatigue, but they were all manageable, and I could live a life and do things and enjoy myself. Immunotherapy adjusts your immune system so that it knows how to fight the cancer off on its own.
We've been in a steep curve of learning and applying treatments to patients. That comes from a big investment in the scientific community over the last 20 to 30 years. The Cancer Research Institute has been focused on funding cancer immunotherapy research, but also organizing a network of clinical trials in this field. And that's where we're designing these new combination studies. We're trying to get to the next step.
Friends of mine often ask me if I'm cancer-free because I've told them the results of what's been going on with the trial, and I'm not cancer-free. But I'm doing great. I'm living with the disease, and I think it's a new way to look at this. A year ago, I was in survival mode, and now I'm looking forward to a future. When I was on this trial, I was able to travel, and we went to Europe for 2 weeks. Just this last weekend, my son and I went to San Francisco and we rode across the Golden Gate Bridge. It means a lot to me to be able to travel with him and to share time and to make more memories. Being in a clinical trial has saved my life. To the people who are helping with this research, I say thank you. It has certainly been a life changer for me, and I appreciate all the work that you're doing on a personal level and for the betterment of cancer research. Well, hello, everyone. I'm one of you. I'm a patient. That video was taken last year. So it's been a year since I gave that interview, and it's been a very good year, I will say that. Since that interview was done, I sold my business. I moved a little bit out of Los Angeles. I'm now living by the beach, and I'm enjoying it very much. I stopped the treatment part of the clinical trial that I was in. My last treatment was in February, and I'm so far doing great still. And also this year, I celebrated my 60th birthday. So I'm happy. I'm very happy. Yeah, things have been going really well. It was 4 years ago that I was first diagnosed with stage 3 metastatic melanoma. And I really did not know what that meant. I didn't know what stage 3 meant. I didn't know what metastatic meant, and I really didn't know much about melanoma. So I thought I'd educate myself, and I went on the internet and started looking. Boy, was that a mistake. It was bad. Everything was bad. The prognosis was bad, the information was old, and it was just really very upsetting all the way around. My oncologist told me what I needed to do was have surgery to remove the tumor, which I did. And then after that, we were discussing, well, what's next? And she had said that the next thing I should do would be interferon, have interferon treatments. And I thought, I've heard that they're not very effective, and is there anything else out there? Are there clinical trials? And she directed me to clinicaltrials.gov, the website. And I went to that website and I looked, and that was overwhelming. The number of trials that are available and to be able to figure out what would or would not be appropriate for me was really overwhelming. I started telling my friends about my diagnosis and what I was going through, and finally I got a referral. A friend of a friend told me about UCLA and Dr. Antoni Ribas, and that I should go see him for a second opinion, which I did. I had my appointment, I went to see him, and he agreed with my oncologist. He had said the next step would be interferon, unless I was interested in a clinical trial. And he was very matter-of-fact about it. He didn't try to sell me on it or encourage me in any way. He just gave me information. And the choice was I could either go into the trial where I might get the placebo or I would get the treatment drug. I didn't like that. I did not want to get the placebo. And even though interferon was not very effective, I still thought it was better than nothing. So I took the paperwork with me and I went back to my oncologist and I showed her the protocol. And her reaction was very different. She said, you have to do this. This is a drug that is known to be working, and the chance that you might get it is definitely worth it. Even if you get the placebo, at least you'll have observation. So I said, okay, I'll do it. Went back to UCLA, said, I'll do it. I got tested for the trial, and I didn't qualify. In melanoma, there is a mutation called BRAF, and I don't have it. So I was excluded from that trial. And so I went to Plan B. I went and I said, okay, let's do the interferon. I had to go to the hospital every day for a month to do the infusions. And then after that, I would do self-injections 3 times a week. There were a lot of side effects with the interferon. One of the problems I was having was that my liver enzymes were very elevated, and I could not continue with the treatment with my liver enzymes so high. So I consulted with an Eastern medicine doctor, and I did acupuncture and herbs, and I was actually able to control my liver enzymes by doing that, and I was able to stay on the interferon treatment. But it didn't work. After 10 months of being on the treatment, I do scans every 3 months. They would find out if it was progressing in any other parts of my body, and that's when they found out that I had a brain tumor. So there it was. Interferon didn't work. I had a brain tumor, and I was stage 4. That was it. That's when I became stage 4. My oncologist said, well, you need to do pinpoint radiation. So I went back to UCLA and I spoke to Antoni Ribas, and he said the same thing, pinpoint radiation and do it right away. That was the first time I had heard about Keytruda as an immunotherapy drug. It was not approved at the time, there were no trials available at the time, but it was something that I was told if there was another reoccurrence, that there might be more options for me. So I did the radiation. I did not have to have surgery because they caught it when it was small enough. That would have been a big surgery. So I didn't have side effects. I didn't have blurred vision or dizziness. So I did the radiation and then came back 3 months later to have it checked. A successful radiation treatment would be that it didn't grow. It didn't go away. It didn't even shrink. But it worked. The tumor stopped growing. That was the good news. The bad news was that they found another lesion, this time in a parotid gland, right here in my neck, right where that first tumor had been. So I went back to UCLA, and sure enough, there were new trials available. I was told about this one trial that I tried to get into. I signed the consent. We were ready to go. And then all of a sudden, the window closed. My slot that I was going to have for this clinical trial was no longer available to me. So I waited. About 2-3 weeks later, I got a call from Dr. Ribas, who said, there's a new trial opening up tomorrow. I want you here first thing in the morning. We're going to get you in. And I did. And I got into this trial. It was 1.5 years after my first diagnosis that I got into this trial. Now this one, it was a phase 1 trial. The 2 drugs involved were Keytruda and T-Vec. They had both been researched independently, but not together. I liked this trial. There was no placebo, and the fact that I was BRAF negative was not a problem. There were 21 people that were in this trial. 17 of us had a positive response. That's huge. That's 80%. There's still 4 people that it didn't work for, and they don't know why. My response was very slow. I got much worse before I got better. After 6 months, I had the tumor on the side of my neck. It looked like the size of a tangerine. And then a secondary tumor next to it, maybe like a walnut size. And very, very hard as a rock, very, very difficult to inject. So after 6 months, I was at my worst. And then it started to soften up and shrink a little bit. By 10 months, it was so small that they couldn't inject anything. I stayed on the trial. I kept coming in every other week to have the infusions. It was a 2-year trial, and the treatment part of that ended in February. Right now, there's a phase 3 trial going on with the same combination drugs, the 2 drugs. There's 660 openings that they're still enrolling people in it right now. Everyone in this trial is going to get the treatment drug Keytruda. Everybody gets the infusion. The part that's being randomized is the virus. Half the people will get the virus injections and the other half will get a placebo. I wouldn't qualify for this trial because of my BRAF status. So I've amassed quite a team in these last few years. There's a lot of people that I've consulted with. At UCLA, there's my doctor, Dr. Ribas, and then his whole staff. And then there's also someone who's a clinical trial coordinator, and she came to every appointment that I had. And she's the person who would make the appointments for me. She would set up my time in the infusion center, tell me when I needed to do blood work, and she's the one who collected all the data. Then there's all the people that work in the labs, in the infusion centers. And then I have my regular doctors as well. I have an oncologist who follows my melanoma. I have the oncologist who follows, the general health of my cancer. I have a dermatologist who specifically follows the melanoma. I have an ophthalmologist who follows the brain tumor. Then I also know everybody at the imaging center. Every 3 months I go in routinely for CAT scans and MRIs. And then there was, of course, the Eastern medicine doctor who I consulted with as well. And then much to my surprise, there was one new person on my team, and that was my cousin, Denise. Denise has a Ph.D. in microbiology, and she works at UCLA. She's part of the team that cured the bubble boy syndrome. She never said cancer. She never said immunotherapy. I had no idea that she was actually working in the same department where the clinical trial was being conducted out of UCLA. And she became such a blessing for me because she would come to my appointments and she could explain to me what was going on, not only from the clinical trial aspect, but also the drugs that I was being given. I really, really like my doctor, Dr. Ribas. He was fantastic. He would talk to me about the treatment I was getting. We had a great doctor-patient relationship, great bedside manner. But then he'd turn to Denise, and it was a completely different conversation. His body language would change, his voice would change, and I realized that they were speaking as colleagues. I wanted to be in that conversation. So I asked Denise, after one of the treatments, what is an antigen? Why does that word keep coming up? I don't know what it means. So she told me, and then she also gave me a book. And the book is what's used, college-level course for an introduction on the immune system. And so I started to read this book. And it was tough. I didn't read the whole book, just the part on cancer. Now, I'm pretty well educated. I graduated from UCLA, and I have a bachelor's degree. I also have a master's degree, but not in biology. This was very, very difficult. But I got it. I know what certain things are now. I know what an antigen is. I understand PD-1, PD-L1, ligands, T cells, receptors, checkpoint inhibitors. And I also know what it means when a drug ends in the name Zumab. I get it. Now, knowing this information hasn't changed the outcome of my treatment, but it has made me a more informed person in my own team. And because of that, I'm a much better advocate for myself. And I recommend that to all of you. Be the best advocate for yourself that you can be. Now, we need to talk about money because getting sick is expensive. I'm sure you know. My initial appointment at UCLA was $700. After that, each additional appointment was $200 until I got into the trial. And then it was all paid for. I was responsible, though, for my own scans, which I did through my own health insurance. And a typical year for me last year, I had 1 PET scan, 4 CAT scans, 12 MRIs, 12 appointments with specialist doctors, and then my regular health care as well. That adds up. I'm watching very closely what's happening in our country with health care because whatever happens, it's going to directly affect me. So when I became stage 4, though, I went to the Social Security Administration and I was put on permanent disability. They have a list there of terminal illnesses, and stage 4 metastatic melanoma was on it. So I was elevated right to the top of the list. I was given Medicare, Medi-Cal, which is what we have in California, and I don't have to pay for anything with my medical expenses. That was 3 years ago. So 3 years ago, I was told that I had a terminal illness. Well, here I am, 3 years later. This is stage 4 metastatic melanoma. Yeah, I'm really happy about that too. Now, I found it very difficult to navigate the system right from the beginning. The finances were difficult to figure out. The clinical trials were very difficult to figure out. And here, I'm the sick person, and I'm the one trying to navigate for myself. It was very hard to be the advocate without help from anybody. I didn't know that there was such a thing as clinical trial navigators. I didn't know that there were patient advocates. I didn't know anything about the Cancer Research Institute. So congratulations to all of you for being here, because you're way ahead of me when I started on my journey. This is a great opportunity for you to get your questions asked and hopefully answered, and to find out what's available for you. Now, we're going to be breaking here for lunch pretty soon, and I'll be here through lunch. If any of you would like to come up and speak to me, I welcome that. Thank you, all of you, for listening, and good luck to all of you in your journeys.
Just an amazing story, and it's been wonderful to hear more and more of those stories over the last 10 years. In fact, we have Christine Sable here in the room with us. Christine, raise your hand. Christine was one of the first patients treated with a vaccine at Roswell Park. She had advanced ovarian cancer, and I met her 14 years ago, and she was one of the first patient stories we were able to tell at CRI, and it's incredible to see you here as well. So there is hope. This does happen.